Hi, this is Zana, the tech guy at Free State Health. Today I'm going to show you how to use the digital stethoscope. The digital stethoscope is a very powerful instrument. This is it here. But before we talk about the stethoscope, I want to talk about this little black box. The configuration of this little black box is very important in order to get the right sound out of your stethoscope. There's a stethoscope icon. Out of this one should be coming a squiggly wire. That wire is actually going to plug into the stethoscope. On the other side of that is a rectangular icon, and this wire is the one that you're going to plug into your handheld on your MITEE. There's a third place with earphone icon. You're going to take your earphones and you're going to plug that right there. The arrow icon, you never want to have anything plugged into there. There are also two dials, a monitor dial and a source dial. You want to make sure both of those dials are dead in the center. The monitor dial allows for listening in the earphones. If you have it dead in the center, you will be able to listen to the stethoscope as well as the sound from the doctor on the other side. And the source button regulates the volume of the stethoscope. So once you have all your wires plugged in, your two dials dead in the center, you are ready to auscultate. But before we do that, let me go over the stethoscope itself. The stethoscope has 4 dials, 2 on top, 2 on the bottom. The 2 on the bottom are the volume dials, so you can go from 0 to 10. I like to keep mine at around a 7. To turn the stethoscope on, I use either of the volume dials, just like this. The dial on the top right is to set the timer for the stethoscope so it times itself out. You never have to use that one, it should be preset for you. However, the dial on the top left is used to change the frequency that the stethoscope will listen. You will notice that if I click quickly on it, it cycles back and forth between 2 frequencies. These are the low frequencies, so this is the scale. Towards the bottom are the lower frequencies, and as you go up, you're listening to the higher frequencies. This setting, which lets you listen to all the frequencies, is the one you should use 95% of the time, and you should have your stethoscope on as a default, unless a cardiologist or a pulmonologist or any other doctor asks you for the bell of the stethoscope, in which case you will want to have this lower setting. To advance between settings, you can hold the button for 3 seconds and down and let it go, and you'll notice that you actually advance between settings, like so. And once you're at the desired setting to set it, you press quickly on the button and you release. And so now my stethoscope is set between these 2 settings. Now that we've gone over how the black box works with all the wires and the dials, the function of the stethoscope, when you're ready, you put your earphones on and you plug the stethoscope in the audio jack right here. And now you're ready to auscultate. When you auscultate, the stethoscope is very sensitive. You want to keep your hands away from the dial. The best way to do this is to put the stethoscope directly on your patient with your hands in the back and directly against the bare skin, so you don't pick up any rustling. And that's the operation of the digital stethoscope.